In the 1300s, entire towns in Europe woke up one morning and simply left. Not because they were told to, not because a war was coming. They left because a neighbor coughed. Doors were sealed with their owners still inside. Children were left on the sides of roads. Parents abandoned dying children, and dying children were left by their own parents, because touching someone had become the most dangerous act a person could commit. The strange part isn't that people were afraid. The strange part is what they became afterward. Because the world that came out on the other side of that plague didn't look anything like the one that walked in. Most people assume an epidemic is something that happens to a society, and then, once the death stops, life goes back to normal. A tragic chapter, then a return to the way things were. That's the story taught in most classrooms. But historians who dig into what actually happened after the worst outbreaks in human history keep finding something unsettling. Societies don't bounce back. They mutate. The disease leaves, but something it changed in the way people think, trust, touch, and organize themselves stays behind, sometimes for centuries. So the real question isn't how many people a plague kills, it's what a plague turns the survivors into. Start with the Black Death, because it's the clearest case on record. Between 1347 and 1351, it killed somewhere between a third and half of Europe's entire population. That number alone is almost impossible to process. But the population collapse wasn't the strangest outcome. The strangest outcome was what happened to the people who survived. Before the plague, medieval Europe ran on rigid social hierarchy. Peasants worked land they didn't own, for lords who controlled nearly every part of their lives, and that arrangement had held for centuries. Then, suddenly, there weren't enough peasants left to work the land. Labor became scarce, and scarce labor, for the first time in generations, had leverage. Survivors began demanding wages. Some walked off estates entirely and sold their labor to whoever paid more. The rigid hierarchy that had defined Europe for hundreds of years started cracking. Not because anyone rebelled, but because the disease had accidentally rewritten the economics of being alive. That's where most explanations stop. But it gets stranger. Historians studying court records from the decades after the Black Death found something researchers didn't expect: a measurable spike in suspicion, accusation, and persecution. Communities that had functioned for generations without major internal conflict suddenly turned inward, looking for someone to blame. Outsiders, minorities, and anyone seen as different became targets, not because the plague had proven anything about them, but because a terrified population needed an explanation, and blame felt safer than uncertainty. The pattern shows up again and again throughout history, and it isn't unique to the 14th century. And that's not even the disturbing part. Centuries later, cholera outbreaks tearing through 19th century cities revealed something about trust itself. When cholera hit London in the 1850s, nobody understood how it spread. Doctors at the time believed disease traveled through bad air. A physician named John Snow disagreed and began mapping cholera deaths house by house, eventually tracing the outbreak to a single contaminated water pump. His map didn't just solve a medical mystery. It quietly triggered a shift in how ordinary people related to their own government. Suddenly, sanitation wasn't a private household matter. It became something the state was expected to manage, monitor, and enforce. The modern relationship between citizens and public health authority, the expectation that governments should protect you from things you can't see, traces back to a water pump most people have never heard of. But this creates another problem. If invisible threats reshape how people trust their governments, what happens when the threat keeps changing? Researchers studying the 1918 influenza pandemic found something even stranger buried in personal letters and diaries from that era. In cities where mask mandates and social distancing were enforced early, people complied almost immediately. but only for a while. Compliance dropped sharply the moment case numbers began falling, even in places where the danger hadn't actually passed. Historians call it pandemic fatigue, but the real discovery wasn't the fatigue itself. It was how consistently it happened. Different countries, different cultures, different decades apart, and the same psychological curve appeared almost every time. Fear peaks, behavior changes, then behavior reverts long before the actual danger does. The body doesn't wait for the science. It waits for the feeling of safety, and those two things are not the same. Then researchers looking at more recent outbreaks found something that should unsettle you more than any of this. Long after SARS swept through parts of Asia in 2003, behavioral scientists noticed that certain hygiene habits, mask wearing during flu season, hand-washing frequency, public tolerance for sick coworkers staying home, remained permanently elevated in the regions hit hardest. Not for a year, not for 5 years. Decades later, the behavioral fingerprint of an outbreak most of the world has forgotten was still measurably present in how people acted in ordinary, unrelated moments. A disease that ended stayed embedded in behavior that never officially ended at all. And here's where it gets personal. Because you've already lived through your own version of this. You already know what it felt like to stand 2 meters from another human being. You already know what it felt like to flinch at a cough in a grocery store. You already know how strange it felt the first time someone reached out to shake your hand again. That wasn't just memory. That was your own nervous system, doing exactly what every documented survivor population in history has done before you. The habits you built during the last global outbreak didn't fully disappear just because the emergency ended. Some of them are still running quietly in the background of your life right now. The way you assess a stranger's cough, the way you hesitate before touching a shared surface, the way certain crowded spaces feel different than they used to, even when nothing about the actual risk has changed. You are not imagining that shift. You are living inside the same behavioral aftershock that reshaped medieval labor markets, 19th century government trust, and 20th century hygiene habits. The pattern isn't ancient history. It's still writing itself through you, which raises an uncomfortable possibility. If every major epidemic in recorded history has permanently altered how the survivors think, trust, and behave, then the version of normal you're living in right now was never actually normal. It's a residue. A behavioral scar tissue left behind by outbreaks stretching back further than anyone alive can remember, layered on top of each other, generation after generation, each one quietly rewriting the instincts of everyone who lived through it. So the question isn't whether the next outbreak will change human behavior. History has already answered that. The question is which of your instincts, right now, in this ordinary moment, were actually built by a disease you never lived through, passed down through behavior instead of memory, waiting quietly for the next crisis to bring them back to the surface.